Gauteng is leading the way countrywide with new COVID-19 infections in the province spiking 39%. The Department of Health said South Africa's cases had climbed by over 10,000 in the past 24 hours, with 50 new deaths reported. The National Institute for Communicable Diseases says this marks one of the biggest jumps in months. Prof Barry Jacobson is a vaccine expert and joins us now. Good evening, Prof Jacobson. Thank you very much for your time. We mentioned Gauteng in the opening there. What's the picture with COVID-19 infection rates in other provinces?
I don't really know, to be quite honest. I only know what we're facing here. So what we're seeing here is a massive surge, which has started the last few days, started the last week or two. And these are quite sick people. I know I personally had COVID 2 weeks ago. So I think that we are seeing the surge now, and it's real.
Yeah, I mean, we'll share the breakdown of those provincial numbers with our viewers in just a moment. But you talk about a surge, and I'm sorry to hear that you weren't well, and I really hope that you have managed to fully recover. We know it can be so persistent, the effects over time. But this current surge, we understand, is being fueled by the Omicron variant. Experts are saying this is because of relaxed public health and social measures. From your perspective, talk to us about the prevalence of various strains and which ones are those that are still quite concerning to health experts.
Well, I think that what we're seeing now with the Omicron is that I'd like to urge the public that those people who haven't been vaccinated yet be vaccinated, and those that require a booster be boosted. We definitely have data showing that patients who have had previous vaccinations have got a lower incidence of severe disease. But having said that, we have seen a lot more cases now of people actually being hospitalized. Luckily, yet we haven't really landed up with these patients on ventilators yet. But the number of people presenting quite sick and actually requiring hospitalization is on the increase. So I think we need to urge the public that they need to be aware that COVID hasn't gone away, that relaxing the social distances made people believe that COVID had gone away. And I mean, it is between the devil and the deep blue sea. The people are suffering because of the financial implications that we suffered from hard lockdowns. Industries that have taken severe knocks, like the tourism industry, travel, the hospitality industry, restaurants have been severely restricted. I think we need to take into account, that poverty and other problems like suicide are real. So there are no real easy fixes at any point in time. But I would like to urge members of the public that we take this wave seriously, that we use our masks, and we don't relax our guard. That it is a real disease, and some people believe Omicron is just a minor thing, a minor flu, and goes away. We are seeing some seriously ill people with COVID.
Here's the thing, though, Prof, only about 46% of the adult population in South Africa is reportedly fully vaccinated. In KwaZulu-Natal, that proportion is below 40%, and among the 18 to 34-year-old age group, it's not much above 30%. How do you reach, what then needs to change in the messaging to convince more people to go and get vaccinated?
It's a very good question, and I wish I knew the answer. But it's a major problem that we're facing for South Africa. I mean, in not only Africa, 10% of Africa is vaccinated. And now we had this terrible report coming out from CDC and the FDA, which I believe to be a little bit irresponsible, saying that they shouldn't get the J&J vaccine when that seems to be the only route that is viable for Africa. The CDC came out saying you shouldn't use the J&J because of the risk of thrombosis, which is very, very low. And I think that's been a detriment to the detriment of Africa, because the vaccine that is available for South Africa and for Africa is the J&J, which is going to be produced under license by Aspen. And it is the only real one that is really viable for us on this continent. And we need to get the message out there. I have quite a few people coming to see me writing letters to say why they shouldn't be vaccinated because they believe, I don't know, all sorts of nonsense. But I think that it is a very real point that we need to try and get to the anti-vaxxers. And because in Africa, our patients, particularly our patients who suffer from retroviral disease, namely HIV, are susceptible to serious disease.
Yeah.
And I think that needs to be brought to the fore. And I think your news channels and any way we can go out there too in the news and get reporters who I think is the way we need to be doing it. Is you have a very responsible job to get out there and promulgate vaccination.
Well, look, we're talking to you now, but the reality is, you know, that the people, when they hear, like you said, that report which you termed as irresponsible around, you know, the efficacy of a certain vaccine and so on. We've seen what's happened in South Africa with the vaccination plant by, you know, the manufacturing plant that has been making the vaccine here in South Africa. That's possibly going to close down because of a lack of uptake. So there are a number of messages there which some people, you know, who, you know, might think, okay, this is my reason then for not wanting to get vaccinated. Where can people go, in your view, for credible information that can answer their questions and allay their concerns about certain vaccines and others?
I think the NICD, and it's a very good point, the NICD should put out a communique. I know they are putting out a communique, but their local healthcare practitioners are out there and they should be allaying to them and vaccinating them. It should be a standard of care that the healthcare workers out there should go to their local GPs and get vaccinated and go to the vaccine sites. And we get the press on a regular basis, like yourself now, going out there on a regular basis, telling the public, if you haven't been vaccinated, go and get vaccinated. That's critical, because the chance of you then having a serious complication from COVID, it won't protect you anyway near 100%, but the chance of you getting a serious disease is markedly decreased by being vaccinated. So we really need to get that out there. And I thank you as a reporter for going and doing this. I think we need more and more of this in the press, in social media, going out there telling people to get vaccinated, because the anti-vaxxers are vociferous in their social media campaigns, stopping it.
Professor Barry Jacobson, thank you very much for talking to us this evening. We appreciate your time. Professor Jacobson is a vaccine expert.